We're going to talk about the fact that May is Mental Health Awareness Month, and we're going to talk about a very big problem that affects hundreds of millions of people all over the United States, and we're going to talk about widespread loneliness in the United States poses health risks as deadly as smoking up to 15 cigarettes daily, costing the health industry billions of dollars on an annual basis. That's according to the U.S. Surgeon General in a statement yesterday, as a matter of fact, declaring the latest public health epidemic. And on board to talk about this, Dr. Fahmi Farah. She is a medical expert and a board-certified invasive cardiologist based in the Dallas-Fort Worth area in Texas. And Dr. Farah, it's really great to have you back on the radio. Thanks for joining us today. How are you?
Hey, thanks for having me. It's great to be back on your show, as always.
Thank you. Appreciate you joining us on the program. And this is really a big medical story that affects so many different people out there. Tell folks a little bit of background about you as we get started. You're based in the Fort Worth area, aren't you?
That's correct, yes. I am based in the Dallas-Fort Worth area. I'm an invasive cardiologist, director of Global Health Lines Foundation, and president and CEO of Bentley Heart Medical Center.
I appreciate you doing this. And most of the audience that you're talking with, Doctor, are truck drivers, and it is a very isolated job that they're out there by themselves, men and women, day and night, and they very seldom have contact with any individual at all. They're driving under federal regulations, an 11-hour driving day, 14-hour duty cycle out there, and loneliness is a major concern for them. How do you see this overall as far as this being a major public health epidemic as far as loneliness goes? What are your thoughts on that?
Yeah, it's a very, very, very important topic, and I completely agree with taking measures. Just to give you a little perspective, mental health plays a huge role in your overall healthy living, mortality, as well as your heart health. So it does have an impact for those, as you mentioned, who are driving and spending so many hours alone. But it just doesn't just end there. It's actually across America. We're seeing it for everywhere, like all sectors. It's not just truck drivers, but it's everywhere. You talk about medical, healthcare professionals, they're on the same boat. And it has huge detrimental impact on your heart health, your overall well-being, and your life, and even mortality. We saw in the study 30%, up to 30% increase in mortality for people who are lonely, which is a huge number.
Does this really take a big toll on the hearts, causing it to work even harder? Depression really create additional problems with the heart. In other words, could this lead to other things like, say, diabetes or sleep apnea? Can this grow, in other words, based on that?
It certainly can, in multiple different ways. So first of all, for those who are lonely, loneliness eventually leads to, as you mentioned, mental health issues like depression, anxiety. And those people who are depressed, there are certain hormones that are not very regular in their body, so to speak, and those hormones can open a whole bag of different things. When people are feeling not very well, when they're depressed, they're less likely to maintain a healthy lifestyle. So it takes a toll on what they're eating. For example, people who are living by themselves, they're less likely to cook for themselves and something healthy. They're more likely to open something from their freezer, like a canned soup, or from their cupboard, or just order in, or just go out to eat. So healthy eating kind of goes out the window for those who are not feeling all that well. Same thing for exercise. Those who are living by themselves, they are less likely to go out to the gym or just just exercise in general. So those healthy lifestyle decisions do get an impact from this. Moreover, people who are depressed, living by themselves, they're more likely to drink alcohol more than usual. And alcohol consumption, it's a huge risk factor for heart disease and overall mortality and health. The same thing for smoking. People who are depressed and are anxious, they're more likely to smoke. So there's just so many factors involved here.
Doctor, I would imagine that there are hundreds and hundreds of millions of people that are struggling in the shadows. Is this maybe a good point to make that it's okay to go check on your neighbor, or, if you see somebody in church or wherever you may go, just to ask them how they are doing? Can just those simple words like that make a big difference in maybe somebody feeling appreciated, maybe not so lonely out there when they hear from other folks?
I think absolutely, yes, it would. In the United States in general, we are kind of isolated, more so than when you go outside the country, like if you go to Europe or Asia. You'll see there's more of a sense of community, which is something we definitely as a whole need to work on. And that's what the Surgeon General was talking about, and I completely agree with that. On top of that, when you add COVID, it has isolated us even more. So the last 3.5 years of this pandemic has really changed our social structure to even more isolation. So before, at least we used to, for the most part, we used to have to go to grocery stores, right? Even that interaction is something, it's human interaction. We need that. Now everything is virtual, and technology is great. It's created convenience in many aspects of our lives, but it's also taken a lot away from us. It's taken that human interaction away. So instead of going to grocery stores, we're now ordering groceries in. Instead of going out to a restaurant, we're getting DoorDash. So those things have a long-term impact.
Drivers, hey, you're welcome to join us. On board Dr. Fahmi Farah, medical expert and a board-certified invasive cardiologist based in the Dallas-Fort Worth area. And we're talking about the fact that May is Mental Health Awareness Month, and one of the concerns with this is loneliness, and widespread loneliness in the United States poses health risks as deadly as smoking up to 15 cigarettes a day. That's according to the U.S. Surgeon General's report declaring the latest public health epidemic. I know many of you are driving solo, that you're out there by yourselves. What do you do to combat this? What do you do to combat loneliness while you are on the road? You've got FaceTime, say on Facebook. You've got your cell phone that you can talk with your folks back home, as an example. But have you formed like maybe a circle of friends in the trucking industry? Folks that maybe you can call when you're on the road. Maybe you're not feeling like you're having the best of days. Maybe you can call that social network of other truck drivers and just kind of like, just talk and see what's going on with them, and then they can see what's going on with you. So how do you deal with this? What do you do to battle this epidemic problem of loneliness on the road? Give us a call, 888-876-2336. And again, Doctor, thank you very much for joining us on the show. Is this maybe also another good indication that many trucking companies that have got drivers out there for long stretches of time, to call that driver, see how they are doing, find out what's going on with their situation, check on safety, see if they've got any concerns? That one phone call, maybe from the company dispatcher, can really make a big difference in somebody having a good day or maybe not such a good day.
I think it's a great idea for more than one reason. It's not just to give them company, but also, when somebody's driving for long periods of time, are they taking proper number of breaks? Because if they're not, they're at risk of so many things like forming blood clots in their legs, for example, or just not having enough rest and they can get into a car accident. So for multiple reasons, I think that's a good idea.
And when you look at the overall health of a driver out there, that unfortunately the age of the truck driver, when they get up into their 50s and maybe their 60s, the mortality rate is going to be much higher than that of the general population, unfortunately, because of that sedentary lifestyle. So the importance of maybe trying to find a combination of exercise, or maybe talking with folks back home, or maybe folks in the office can really make a big difference. So would you recommend, doctor, that say if a company's got a pet policy that maybe the driver get a doggy or two, and or maybe another pet, put that on the truck? They're great companions, right? They're always wagging their tail and showing how much they love you. Good idea to get one?
Sure. I am a puppy lover, so I think a puppy can always make somebody feel better. They're great companions. I will say I recently had a patient in my clinic, and the patient is a truck driver, and he just gave me his schedule. It's horrible. It was awful. Like, I'm not saying that all truckers have horrible schedules. I'm just saying this particular patient told me, like, his hours. And he didn't have enough time off to be able to take care of himself. Like, every day he was pulling like 15 to 16 hours a day. And so when he's getting out of his work, he didn't have enough time to take care of himself or engage in healthy behavior. Like, he's too tired to make something healthy for himself. He's too tired to work out. He said, like, he's not even getting enough sleep. He's getting less than 5 hours of sleep a night because of the amount of time he has off. It's just not enough. So I would urge all companies, and it's not just unique to truck drivers, it's every industry, including healthcare industry. We're just as, up there in terms of how hectic our lives can get at work. I think as a society, at every sector, we need to step up to the plate and just offer support, reduce hours, and just give people the chance to reconnect with community again and reconnect with life. I just feel like we've all kind of disconnected from life to some degree.
Yeah, absolutely. And we get so wrapped up in our everyday schedule that a lot of these things will often go to the sidelines. And then this would have, I imagine, a cumulative effect. Because the more maybe you ignore addressing this, can the problems get worse as time goes on if you don't acknowledge them?
I certainly think the problem can and will get worse, and COVID was a huge example of that during this pandemic, just how isolated we've become. And if you looked at the numbers, the new studies are showing that heart attack rate is up. So that's just one side, but there's just so many important aspects to look at. And COVID, the pandemic, has really taught us what detrimental impact isolation can have on us, not just on our health, but in our life in general. Overall, it's not good.
All right, let's do this, Doctor. We're going to break for the commercials, and we're going to come back on the other side. I'm going to put you back on hold. And drivers, you're more than welcome to join us. I would imagine that many of you hear from your company maybe once a day, maybe more than that, just checking on you, because trucking is a very lonely, isolated job. You're out there for long stretches of time with nobody to talk to. You're just out there and you're just kind of driving. Does your company reach out to you often, maybe once, twice a day? Just to check on you, see how things are going for you out there, and do you have like maybe a family support structure back home? Say maybe you've got a spouse or kids back home that maybe you call at the end of the day, just see how they're doing. You let them know what's going on with you, and vice versa. And the other big thing I think maybe we need to factor in is the idea that maybe forming a friendship circle, if you will, maybe finding other truck drivers that you can call pretty much day or night and just kind of shoot the breeze with them, just talk with them, hearing another voice out there, especially from somebody that's working in the trucking industry alongside of you, can really go a long way. They're going to understand what you're going through and maybe give you some remedies and ideas that will help you to get around this. And again, feel free. May is Mental Health Awareness Month, and we're talking about loneliness, big problem out there in the industry. May, by the way, is Mental Health Awareness Month, and on board to talk about this is Dr. Fahmi Farah, medical expert and a board-certified invasive cardiologist, based in Texas in the Dallas-Fort Worth area, and we're talking about a very serious subject that can certainly create some issues for your heart and some other medical concerns, and that is widespread loneliness in the United States. A new report out from the Surgeon General has declared it the latest public health epidemic, and loneliness in the U.S. poses health risks as deadly as smoking up to 15 cigarettes a day, and loneliness is a common feeling that many people do experience, and there's ways to maybe alleviate it. Try to get around it, because the longer you linger in it, it can create some more medical and other issues. Let's go first up to Clemson, who is on the air with us. Clemson, welcome. Where are you calling from?
I'm coming through the gorge right now in North Carolina.
Welcome, good sir. You're on with the doctor. What are your thoughts on loneliness?
I was just calling you, asking some things that we can do out here not to be lonely. I hang out on a Zello channel. I got a Zello app, and there's a bunch of us truckers that hang out in there together. We talk all the time, so that's how we do it. Yeah.
Nice. And what is it called again? What's the name of it again?
It's Zello. Zello is the name of the app, and then the channel is Mother Truckers Channel 19.
Okay, cool. Very good.
Yeah.
And this is where you can reach out to other drivers, right? And it's kind of like a 24-hour chat session?
Yeah, it's like a CB. Yeah, it's like a CB. You can use your Bluetooth headset. You can use your Bluetooth button to key up like it's just like a CB, except it's an app.
Okay. Very cool. Yeah. What would you recommend to the new drivers out there, Clemson, that are out there brand new, freshly minted CDL, and they're running into this? What would you say to them about loneliness on the road?
I would say try to find something like what I'm talking about, or something where or even reach out to friends and family back home or something. Just try to stay in communication with somebody, I guess. I never really had to deal with it because I've been in that Zello channel since before I come back trucking. So it helped me out when I first started back trucking. It helped me out because I had all them guys that was truckers in there, so I didn't have to worry about if I had a question about sliding my axles or something like that. I had them all right there, so I never had help. So.
Absolutely, but what a great recommendation for the drivers out there, and I appreciate the phone call. And doctor, to the point of that, technology has stepped in and is actually making a difference where it's bringing people together. In the case of what he was mentioning with Zello. So look for things like that. It sounds like would help in this situation.
Lord, that's fantastic. It sounds like they have a little support group within their, similar truck driving jobs. So that's excellent. I think that's a model that all industries can hopefully follow. It's so nice to have support groups like that. I think that's excellent. And this is one of the pros of technology, I guess, just as it has negatives, it has pros too.
Yeah, and again, like you're mentioning, though, that if somebody is in a position where they're experiencing loneliness on a continual basis, and this is going to be part of the job for trucking, try to find ways to alleviate this, because there are some major medical things that can come up. Again, circling back to that, this could be heart-related. This could be maybe leading to things like sleep deprivation, sleep apnea, maybe push somebody towards, say, diabetes. If it's not corrected. So is there a connection with all those? How do you see that?
There is, yes. So as I was saying earlier, when you're not eating healthy, when you're depressed and you're not able to sleep well, because people who are not feeling well, they're depressed or have anxiety disorder, they usually have some sort of sleep disturbance. They usually have a hard time sleeping as well. And as you know, the American Heart Association has said earlier this year that sleep apnea, or not sleep apnea, so just sleep disorder in general, has been added as a risk factor, major risk factor for heart disease. So yes, I certainly think that it does have a huge impact on your overall health and most definitely on your heart health.
All right, doctor, thank you very, very much, and really appreciate you joining me on the show. live to talk about all of this. And again, May Mental Health Awareness Month, and that's why, drivers, it is so important for you that, if you're experiencing issues, that you got to reach out to somebody. And again, truck driving is such an essential job that has got to get done. You guys are the backbone of America, but so many other obstacles that are in your way, like loneliness, for example, it can really have take a tremendous toll on your health out there. And again, thanks to Dr. Fahmi Farah, medical expert, and talking about how this can lead to other medical issues. Doctor, let's get your website out there and social media, phone number. Where can folks reach out to you if they need some more information? Where can they go?
Sure. My social media handle is at Fahmi J. Farah for Instagram and Twitter. And my website is bentleyheart.com. I also have a press page. That's Dr. Fahmi Farah, press.page.
Come back and join us soon. I really appreciate you joining us on the show.